So today I will be discussing about the rationale and the cultural adaptations and why we recommend using this type of therapy, which is exposure therapy. So the rationale that I've researched on many credible websites that I've cited in our PowerPoint, it is catered to it, which correlates with PTSD. Now, this therapy does have reduced the symptoms of many aspects of post traumatic stress disorder. However, it can be very difficult for many other patients who are, fully engaged into this reliving or retelling their traumatic experiences, um, especially with exposure therapy. It's how they use it cognitively, the main mechanisms that they've used with prolonged exposure and how it helps with those. But I would say that the rationale to this is very helpful. The pros or the strengths in the PowerPoint outweigh the only one weakness that it is that it's just it's a low risk type of treatment. But however, the strengths is that it does reduce all of the uh, sensitive situations that I've discussed. Um, it helps overcoming the fear that you've dealt with in the past as well. As for the cultural adaptations, so on the research that I have looked on this, that I've selected on this exposure for exposure therapy. So this was selected because I have researched it on a very credible website on how PTSD correlates with African Americans with the practice of exposure therapy, and how it correlates the cultural adaptation with the factors of how African Americans are, the factors with the African Americans with cultural adaptations plays a part. So it's usually how African Americans deal with their lives on a daily basis, such as everyday and their everyday breathing life, such as racism, discrimination, marginalization. However, there is a cultural gap. From my information that I did look up on this credible website is, or this article, I would say, is that they did discuss how sometimes with African Americans who go to someone who is not, that looks like them, specifically a European American clinician, there is a very cultural gap, which means that they don't, clinicians that are European do not understand what it is to deal with as an African American on a daily basis. Also, another factor that I did look up on the article is statistics on how this how African Americans deal with their own. Another factor with is this also ties in with how educational and income backgrounds are, due to lack of resources. I know from the information that I did see is that African American teenagers, high school dropouts, and college dropouts lack of the resources to fulfill this type of need for this therapy. Um, it doesn't go as successful as it's stated in the beginning of the article that I've researched on, which is very credible. Um, Also, it's very distant. I apologize. PTSD is very disfranchised with African Americans with higher ratings than their European counterparts, especially with the general public as well. Um, they don't receive treatment. If they do receive treatment, it's usually the kind of cultural mistrust, meaning what I just said earlier. I would also say that sometimes African Americans, in the article that I did read from the notes as well, they did say if to by the failure of the treatment, they will sometimes will encompass some difficulties as well, and it's just racial, as I said, racial related traumas that African Americans have. And it decreases the successful rate for African Americans to receive these type of treatments. Cognitively, usually behavioral treatments approaches are very highly effective for African Americans. as well for the, as I just stated, prolonged exposure therapy, and in particularly the, which is the most support for the treatment of PTSD. And I did put in the slides in our PowerPoint some illustrations on how it explains prolonged exposure to therapy and how it works for those who have PTSD, specifically for African Americans. I did put some illustrations as well in the to make it more simpler for those who don't understand what it's like for exposure therapy. Um, and why we recommend why we recommend exposure therapy. Well, exposure therapy has been always the aim of this form of treatment to help the patients confronting their fears, basically, their situations, their memories, their objects, or any images that they've felt until their anxiety does decline or decrease in this case, because it helps overcome, as I stated, their traumatic experiences and events that they were exposed to either from childhood or even up to adulthood. Um, it reminds them that if we remind our clients, if they successfully follow through, that they will overcome their traumatic experiences. Now, this may not work for everybody, but I recommend that they should talk it out with this type of exposure. It's been very helpful for those who are overcoming their types of fears, or until their anxiety does calm down once it's all comes together with the type of the relationship, depending on the clinician and everything that they with whatever the client is dealing with. Yes. um I would also say that this does remind the clients on how to be interactive with the, how would I say, with the situation that they were presented. Like in the first few therapy sessions, they're gonna have to relive some traumatic experiences, which is very understandable. It's very key to like be fully into the process, because as I stated earlier, African Americans don't, when they try to do an attempt to adapt this type of this exposure therapy, it's going to be very difficult for them to fully understand. If they had somebody who looked like them as an African American, now then they would be more comfortable. But in this case, a lot of African Americans tend to get the treatment by, as I stated earlier, European American, or in this case, white American clinicians, and they feel very uncomfortable. There's a cultural gap that most people do not understand. So in the text, I believe, in the article that I've searched on this website, it did say that as clinicians or of different races, they have to understand a cultural gap, a cultural knowledge in that case, which is very good and very understandable. I would say altogether, this whole topic has been very resourceful for those who are wanting to trigger their past traumatic experiences, and to relive it so they won't let their anxiety slash their fear take over it, and they're very more comfortable and ready to talk about what they dealt with as a child on up. So I would recommend that this therapy is very helpful for it. It helps reduce all of the things here, mentally, cognitively, especially physically. I'm not going to get too religious, but sometimes it can help spiritually. Sometimes they've dealt with some type of thing and within the religion. You may never know. I mean, just, I would say cognitively and physically, this will help them reduce their stress levels, as well as their mental, because their mental is what's making them have these type of anxiety slash fear with them reliving traumatic past post-traumatic stress disorder as well, like PTSD they've dealt with in their minds and everything. So I recommend this because this is helpful. It aims to there's an aim for this type of treatment to help the patients to confront their fears and everything, but in a more positive way. But however, this doesn't work for everybody, but I recommend for my clients to do that for that. So thank you for watching my video.